Thanks, Emily, for that kind introduction. My name is Marla Guzman. I'm a pediatric rheumatologist at Summit Health. My main office locations are in New Providence and Berkeley Heights, and I'll be at another satellite location in Clifton starting next month. So this talk I thought, a really great idea that was suggested by the Arthritis Foundation, because there's lots of little ways that changes in our routine, particularly during the holidays, can perhaps increase the risk of a flare for any type of arthritis. So today's talk is kind of geared towards that. How can we manage arthritis during the holiday season when things get a little bit crazy and we're not doing our normal routines, because a lot of times disruptions to these routines, amongst other variables, can cause our arthritis to flare. So just a little bit of a breakdown of what we'll be talking about today. So who is this talk geared towards? Why are we talking about it? I kind of mentioned the latter. Why is it important to talk about flares? And why is it important to talk about triggers? So we'll be talking about that. And what is a flare, and why does it matter? And then I'll be discussing specific triggers that can lead to flares, perhaps disrupting the holiday season for your child. So things like infections can certainly do that. How do we prevent infections? The best answer to that is usually vaccines. Travel can certainly cause a disruption, and as things are slowly getting back to normal, we're hopefully traveling a little bit more safely, so that comes into play as well. Then I'm going to talk a little bit about food and how changes in our diet can perhaps impact the severity of our arthritis, changes in weather, changes in medications, and then a couple of other miscellaneous topics like, vacation and insurance. And then I'll be happy to answer any questions. So who is this geared towards? So there's many pediatric rheumatologic conditions that have arthritis. And as we know, arthritis is pain, swelling, stiffness, limited range of motion in a joint. It's not just limited to kids who have JIA. Lots of patients for various reasons may have arthritis. So the most common reason is usually juvenile idiopathic arthritis, or JIA. And as most of you probably know, as parents or caregivers of children with JIA, there's several different types, which is far beyond the scope of this talk. But we have an oligoarticular JIA, polyarticular, psoriatic, enthesitis-related, and systemic JIA. Systemic lupus erythematosus, or lupus, can also very commonly present in children with arthritis. Juvenile dermatomyositis, which is an inflammatory condition of the muscles, can also present with pain, swelling in the joints. Vasculitis, periodic fever syndromes, and other chronic conditions that a rheumatologist may co-manage with other specialists can also cause arthritis. So children who have thyroid conditions, such as Hashimoto's, can sometimes have pain in the joints. Inflammatory bowel disease, these children can somewhat frequently get arthritis. So children with Crohn's or ulcerative colitis, and children with celiac disease as well. So anybody who's affected with any of these conditions could benefit from hearing some of these tips today. So what is a flare, and why does it matter, and why are we talking about it? So a flare is an exacerbation of an underlying condition. So in non-medical talk, it's just worsening of your disease. And there's lots of reasons why you can have a flare. Sometimes it can happen on top of an already active disease, and sometimes it can just happen after a long period of quiet disease activity. So your child may have been off of medications for a while, and all of a sudden you notice that their arthritis is flaring. And so we don't always know why. Sometimes it just happens, but sometimes we can identify triggers. And we do our best to try to avoid them as much as we can. So what are these triggers? So the main trigger that I'll be talking about is infections, because infections trigger all sorts of autoimmune or autoinflammatory conditions. So viruses, bacterial infections, those are the more common ones, and particularly in the pediatric population, viruses. And there's millions and billions of viruses out there, and any of them can trigger a flare. Stress, whether it be physical stress, emotional stress, can also trigger flares. Poor medication compliance. This is obvious. If your child is not taking their medication for any reason, that's most likely going to trigger a flare of the disease. And then the sun can actually trigger flares in certain conditions, particularly conditions that have photosensitive rashes or rashes that are affected by the sun. So juvenile dermatomyositis and lupus, just being in the sun can trigger any type of flare in those conditions, even arthritis. So you may think that it may just trigger a rash, but there's all different aspects of these conditions that can be triggered by the sun. So that's something to keep in mind for those patients. And flares can be mild, meaning you may just have to take, a non-steroidal anti-inflammatory for a couple of days to get through the flare, maybe, work on your physical therapy. But they can also be severe to the point where you may have to change your medications or increase the dose or even be hospitalized. So it's really important to try to prevent these from happening. So as I mentioned, very common trigger are infections, particularly viral infections. And this is particularly relevant in the pediatric population because children get viruses all the time. And there isn't just COVID. COVID isn't the only virus out there. There's millions and billions of viruses that we need to be aware of, especially during the winter months. As it gets colder outside, we're inside more. These infections tend to spread more and are more prevalent during the winter months, particularly in kids as they're returning back to daycare and school over the past couple of years where they may have been home. So some common viral illnesses that we see are RSV, flu, enterovirus, parainfluenza virus, human metapneumovirus, rhinoviruses. Those are all just kind of fancy names for different types of common colds that we see during the winter. RSV and influenza are the exceptions to those. Those can be a little bit more severe in our pediatric populations. So they don't only increase the risk of a flare, but as you may or may not have been told by your provider, sometimes you may have to hold the immunosuppressive medication that the child is on in the event of a fever or serious infectious illness. For various reasons. And holding these medications obviously will increase the risk of a flare because the child is not taking the medication. So these are all things to keep in mind. There's lots of different factors that can lead to the patient having a flare, not just the infection itself. So there's lots of easy strategies to avoid getting sick. And I think we're all probably pros at this point. So good hand washing, avoiding contact with sick people, wearing a mask, vaccinating if possible. And I'll talk a little bit more about that with regards to COVID in a little bit. But the flu vaccine, anyone 6 months and older should be getting the annual flu vaccine to prevent the risk of serious outcomes from the flu. So talking a little bit about COVID-19 and how this can perhaps increase the risk of a flare in general. So again, we know all these things. We need to mask up, and this is only relevant in kids who are 2 and older. The CDC does not currently recommend masking for patients or children under the age of 2. Trying to social distance as much as we can, staying 6 feet apart as much as possible. Now that the holidays are upon us and we're starting to get back to normal, and we're starting to see family members again, avoiding large indoor gatherings as much as you can. And consider having every participant in the gathering take a rapid COVID test prior to the gathering, just to have that extra sense of security. Avoiding poorly ventilated spaces, continued good hand hygiene, and then, in my opinion, the most important is vaccination. And this is not just true of COVID again, but for the flu virus as well. The link below has everything you really need to know about COVID-19 on the CDC website, really in great detail. So it's a good resource to have. So going a little bit more specifically into the vaccinations for the flu vaccine, like I said, anyone 6 months and older can get the flu vaccine. If your child is on an immunosuppressant, the injectable form or the shot of the flu vaccine is completely acceptable to get. It's an inactivated virus. If your child is on an immunosuppressive medication, they should not get the intranasal form, which is the spray, because this is a live attenuated virus. So there are risks of viral reactivation in immunosuppressed patients. This form is really not very common. So most people probably won't run into this issue. They'll most likely be offered the injectable form. The contraindications to getting the flu vaccine are pretty minimal. If your child has had a severe life-threatening allergic reaction to any ingredient in the flu vaccine, or if they've had a severe allergic reaction to the flu vaccine in the past, you should talk to your doctor, probably most likely your child's pediatrician, before getting the flu vaccine if you're concerned. There used to be a concern about egg allergies and the flu vaccine. That concern has kind of been resolved, but we do still say if you are concerned and you're not sure, talk to your pediatrician or your child's allergist before getting the flu vaccine, and they can kind of guide you through that. And then all other routine childhood vaccinations will also prevent a lot of vaccine preventable conditions that may trigger a flare. So discuss with your child's pediatrician and rheumatologist if your child needs vaccines and when they're due. If your child needs a live vaccination, this may alter medication treatment, because depending on the medication, the medication might have to be held prior to being given the live vaccination, for the same reason that the live attenuated forms of vaccinations may reactivate the virus in an immunosuppressed patient. So that's something to discuss with your child's pediatrician. And in terms of the live vaccines, measles, mumps, rubella, and the chickenpox or the varicella vaccination really are the two main live vaccinations that are given routinely during childhood, usually at age 1 and 4. So anyone older than that, really, this does not really apply to them. Yellow fever vaccination, which you may get prior to travel to somewhere exotic like Africa, where yellow fever is a concern. That's a live vaccination. So if you're planning on traveling, internationally, it's something to consider as well. So the COVID-19 vaccination, as you know, in the news, things are changing pretty much by the hour in terms of recommendations and boosters and doses. So I'm just going to kind of sum up a little bit here what we know as of today. And again, the CDC has lots of great information, but things you need to know, particularly in relation to your child who has arthritis, just a couple of important points. So the Pfizer vaccination is a 2-dose vaccine that was previously approved under emergency use authorization, now FDA approved in children 12 years and older. And as we know, over the past couple of weeks, it was approved under EUA for children ages 5 to 11, which is wonderful. And again, another 2-dose vaccination series. The Moderna series is 2 doses. This is for 18 and up, and same with the Johnson & Johnson. It's 1 dose, but 18 and up. The contraindications are also very, very limited. If you've had a severe allergic reaction, and by definition, this is anaphylaxis or lip swelling, or trouble breathing, throat closure, belly pain after a previous dose, or to a component of the COVID vaccine, you would want to discuss this with your child's doctor. This may be a contraindication. If you've had an immediate allergic reaction of any severity to a previous dose, meaning rashes, feeling itchy, just kind of overall not feeling well, or a known diagnosed allergy to a component of the vaccine, you should talk to the pediatrician or rheumatologist. But other than that, everybody of age eligibility is eligible. So, and this includes patients who are immunosuppressed. It includes patients with rheumatologic conditions, and they, most importantly, should actually be getting the vaccinations because they're at higher risk for serious poor outcomes from COVID. And again, this is changing by the minute, but we now know that booster shots may be helpful. And here I'll just differentiate a little bit between a booster, and then a third dose. So the left two tables are referring to boosters. And if your child has received the Pfizer or Moderna vaccination, as of now, the recommendation is that they can receive a booster 6 months after their second shot, preferably of the same brand, but if they cannot, it should be whatever's available. And they have to qualify for any of these conditions. So as of now, they're saying 18 plus. So that does limit some of our kids, but if they if they live or work in a high risk setting where they may be exposed to more instances of COVID, for instance, if they maybe volunteer somewhere, or if they have a part-time job in a restaurant or a coffee shop, where they're really face to face with people, this may be may make them eligible. And if they have underlying medical conditions, of which there's many that are listed on the CDC website, so you can see if those apply. If they receive Johnson & Johnson and if they're 18 or older, at least 2 months after the initial vaccination, it is actually recommended that anybody who's received this vaccination get a booster. The right chart, I think, is probably a little bit more relevant to our kids and our kids who have arthritis and other rheumatologic conditions. It's discussing specifically what to do if you're immunocompromised. And the reason that we focus on this so much is because we know that our kids who are immunosuppressed may not be able to mount the same immune response to the vaccine as their healthy peers who are not on immunosuppressive medications. So again, this is all things that we're learning literally in real time. But in order to try to boost the immunity, we give them a third dose. So it's not necessarily a booster, but we consider it an actual third dose. And the difference is that they can get this third dose 28 days after their second dose, rather than waiting the 6 months. And that's highly recommended to do as well. With regards to holding the medication around the time of the vaccine, that is something that's changing also by the minute and by the day. So if you are planning on getting your child vaccinated or getting them a third dose or booster, you should discuss with your child's rheumatologist with regards to whether or not the medication needs to be held and for how long. Okay, so moving a little bit away from COVID, what are other things that can trigger flares during the holidays? So we may be driving to see family members or relatives, and we may be in the car for a while, especially if we're not so certain that we want to get on a plane just yet. And as we know, being sedentary or sitting makes the feeling of arthritis, pain, and stiffness worse, especially if you're in a very long car ride. So make sure that you're taking walking breaks during these long car rides, even to just kind of stand up and have your child just take a loop around a rest stop. I think that's probably enough to kind of get them through the long car ride. If you're flying, there's a few things that you should consider that you may not be obvious. Obviously, you want to make sure that you have enough refills for medications if you're going to be away. Make sure that you have your child's rheumatologist contact info handy in case something happens, in case there's a flare, in case you're worried about something. You may not be somewhere that has easy Wi-Fi available, so you just want to make sure that you have that contact info handy. And then if your child is on an injectable medication, so if they're on Humira or Enbrel or any injectable, be sure that you try to get a letter from your child's rheumatologist before you travel, because TSA may have some issues with the child carrying the sharps on the plane, and typically a letter from the doctor stating that it's medically necessary is usually fine. So make sure you have this so you don't get stopped at the airport and have to leave your Humira at the airport check-in. If you're going somewhere warm and sunny, that's great. I'm jealous. But if you are, as I mentioned earlier, sun, UV light can trigger flares, particularly Well, really only in kids who have conditions like lupus or dermatomyositis. So just be mindful that this is the case, and pack sunscreen of SPF 30 or above, and pack a hat, and just try to stay out of the sun as much as possible if this is the case. So as we know, during the holidays, we tend to not eat the healthiest. And there's really no hard data on diet and how it impacts autoimmune conditions in the pediatric population. There's lots of talks of the anti-inflammatory diet. I get questions from families a lot regarding this, and is there any way diet can somehow prevent my child from getting arthritis or treat the arthritis? The general answer is no. However, the Mediterranean diet and other healthy diet choices can certainly have anti-inflammatory effects in conjunction with medication use. So it's really important to consider implementing these into your child's diet. And this is, combined with medication, physical therapy, exercise. Foods like fruits or leafy greens, like spinach, collard greens, foods rich in vitamin D and calcium, plant-based protein, so beans, nuts, legumes, and then fish and lean meats. Those are all kind of part of the Mediterranean diet, and it certainly is helpful in preventing flares during the holidays. And on the flip side, we want to avoid foods that are high in sugar or processed foods. These foods are not healthy in general, and they certainly don't have some of these anti-inflammatory properties that the other foods do. So best to avoid those. And how can the cold affect our children with arthritis? So when it's cold out, there's fewer opportunities to go outside and exercise and do the things we like to do to move. And as we know, movement is great for arthritis. It's good for the joints. We don't want our kids to be sitting around not using the joints. So, with outdoor pools being closed, activities such as jogging, cycling, and hiking, those are difficult to do when it's 30 degrees outside and snowing. And then when it's cold out, we just generally feel lazy. We don't want to go outside, and the gym might be closed. So, these are barriers to getting our kids moving and staying active. So light activity is always recommended. And so low impact activities that you can do inside your home, like yoga, swimming, not so much, but swimming you can do in an indoor pool, Tai Chi, going on a stationary bike. There's lots of apps these days where you can hop on a bike and, join a class virtually. And there's lots of apps where you can join classes virtually or even solo, where you can do things like yoga, Pilates, lots of different activities that you don't have to leave the house for that get the joints moving. So I think it's really important to remember that, because I think that often gets neglected. And then just a couple of other miscellaneous things that are not so obvious, but can certainly lead to disease activity. So first one is insurance. So kids are typically covered by their parents' insurance, and insurance is typically employer dependent, and oftentimes there is a change in insurance for whatever reason starting on January 1st, and parents may or may not realize that as a result of this, the new insurance may not cover the methotrexate or the Humira or the Enbrel. And then all of a sudden they're in a hard place because they are missing a month or two of Humira until it gets approved. So that's something to keep in mind. This is particularly true of infusions. So if your child is, on Remicade or Orencia, tocilizumab, whatever infusion that they're on, insurances are notoriously difficult with giving approval for these. So if you have a new insurance policy and your child is on one of these medications, certainly this is something to keep in mind and to make sure that it's covered with your new insurance policy. And even the doctor's visits, you probably have an attachment to your child's rheumatologist and you want to continue to bring your child to see them. Make sure that the new insurance covers whatever organization or institution that they're part of. So these are all things to kind of keep in the back of your head so you don't have a setback in your child's disease. And these are all things you should really try to clarify way before the new year, just so you have this all in place. Changes in routine can certainly mess up your schedule and mess up your compliance. So if you're sleeping in, if your child is sleeping in because they don't have to go to school and they normally take their medication, at 7 in the morning, they may not remember to take it at all the rest of the day if they're sleeping in. So try to set alarm reminders on your phone or your child's phone to really try to remember to take these medications. And if you're traveling, you might be in a different time zone. You get kind of excited about being somewhere new. You may forget to take the medication. So just little tips to try to avoid that from happening. On a positive note, there's things you can do during free time while your child is home from the holidays. So things like meditation, massage, these are all great complementary treatments to the medication and exercise that we prescribe to try to help ease arthritis and ease the risk of a flare. So try to have your child do these while they have free time off from school. And then this is also a really great time to try to connect virtually with other parents or families or other patients through various means. And we're all very good at connecting virtually these days. And the Arthritis Foundation has really a lot of great resources for families and caregivers who of children with JIA or really any rheumatologic condition. So things like the JA Connect groups, the JA online community, and there's ways to get involved, like the Jingle Bell Run, which is coming up. So there's lots of good ways to do that to try to kind of get a better understanding of your child's disease and what other people are going through.
I have about 5 or 6 questions here for you. I'm hesitant to get my child the COVID vaccine. Is it safe for my child with arthritis to get it?
Yeah, that's a great question, and it's probably the most common question that we're getting these days. As I mentioned during the talk, yes, it's absolutely safe as long as there's no allergic contraindication. And with regards to holding medications, definitely discuss with your child's doctor whether or not any medication has to be held and for how long surrounding the administration of the vaccine.
Okay, thank you. Our next question is, what happens if there is a change in insurance during the new year and my child's infusion medication is denied with the new insurance?
Yeah, that's also a really good question. Just kind of stay ahead of things. Like I mentioned, in November, is usually when open enrollment happens for a large majority of organizations and employers. So when that happens, as soon as you change your plan, if you're changing your plan, give your insurance company a call and verify that they're able to cover the infusion medication, the specialist visits, injectable medications. If you're having trouble navigating the insurance world, which is very common, you can certainly recruit the help of your child's rheumatology team.
Thank you. Our next question is, do you have tips for explaining dietary needs and restrictions to hesitant and skeptical family members?
Okay, yeah, I'm assuming that means avoiding certain foods or maybe more anti-inflammatory foods. So in terms of tips for difficult family members, I don't know if I'm the best person to answer that question, but I think just in general, I think explaining a lot of people don't understand that children can get arthritis, and a lot of people don't understand that children can get a lot of these more severe chronic autoinflammatory or autoimmune conditions. So they may not have a full understanding of what exactly is going on. And I think the best thing to do is to really just kind of explain that, juvenile arthritis is a chronic autoimmune condition and can be triggered by certain things, and things that are best to avoid are unhealthy processed sweet foods as much as possible. I mean, kids are still kids, so you don't want to deprive them of that altogether. But really just trying to explain the rationale behind why you may be making certain dietary choices for your child.
Our next question is, would you consider going to the movies in an N95 mask, even if others are not masked? I know you cannot guarantee, but looking for risk level thoughts.
It's a good question. I myself have not yet been in a movie theater with unmasked people. And I'm fully vaccinated and not immunosuppressed. So I tend to be a little bit more cautious. I think it really just depends on your comfort level. If you're going to be in a movie theater and your child has arthritis or your child is on any immunosuppressant medication, probably best to be in a movie theater where people are masked. Obviously, we can't know if everybody in the theater is vaccinated, but I think the safest thing to do would be somewhere where they're requiring masks during the movie, and to try to go during kind of weird times when it may not be as crowded. Maybe going to a matinee or going before dinner.
Okay, our next question is, any idea when the booster will be available for kids under 18?
That's a good question. And I actually, as I was kind of reviewing the recommendations, I kind of wanted to double check that because from my understanding and from the CDC website, it currently is 18 and up. And from what I understand, they're about to authorize booster shots to be available to any adult. So I would imagine that kids 12 and up probably would be not that far behind, but it's hard to say right now.
The next question is the quote unquote third dose still just for 18 plus?
No.
Okay, and then the last question I've seen as of right now is, how long should you wait to receive the vaccine if your child contracted COVID?
It's a good question. And I actually don't know the answer to that. That is something probably you would want to discuss with your child's pediatrician. I think it probably depends on several variables. So unfortunately, I don't know the answer to that.
Does anyone else have any questions? Because those are the ones that I have seen throughout the presentation. Feel free. Okay, so another one. So if your child is immunosuppressed, they should be able to get the third dose.
Yes, and they should get the third dose for that very reason.
Is there any additional questions? I am not seeing anything else come through. So, okay. It looks like I'm going to say I'm not seeing anything else come through. So I think that I want to thank you very much for your time, Dr. Guzman, and I really appreciate you sharing this really valuable information.
My pleasure. Thank you, everyone.
Thank you, everyone, for joining us.
Have a good holiday.
Yes, happy Thanksgiving and have a great holiday.